Assalamu alaikum everyone. My name's Zainab. I'm from the Muslim Council of Britain and I'll be hosting the session this morning. Thank you so much to everyone for joining and to all of our panelists today. I'm going to hand over to Harun Khan, Secretary General of the MCB, to start today's session with a recitation of the Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الصلاة والسلام على رسول الكريم بسم الله الرحمن الرحيم يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. O you who have believed, decreed upon you is fasting as it was decreed upon those before you, that you may become righteous. Assalamu alaikum wa rahmatullahi wa barakatuh. Brothers and sisters, Jazakumullah khair. Thank you very much to all of you for joining us again for this weekly COVID-19 briefing, which has been carrying on for about 3-4 weeks now, alhamdulillah. And MCB, working with partner organizations, has been bringing you information every week, up-to-date information, factual-based information and guidance to assist our community to really tackle this immense challenge that we're facing as a community and as a society. And we hope that you find everything that's been presented useful and beneficial for yourselves and for your families. You'll see a lineup today of different topics on which will be of benefit. And the verse that I just recited is very often recited and mentioned. Is the opening verse in Surah Baqarah, verse 183, which makes reference to fasting and Ramadan. And I'm sure the speakers coming up on the agenda today will delve more into the topic of fasting and Ramadan and how we as Muslims in the current lockdown environment are able to practice Ramadan to the best of our ability and to get the best reward and the most benefit from this holy month. For us in our lifetime, this is unprecedented, that the experience will be very different to what we have seen before, where we're not able to, obviously for the last few weeks, we haven't been able to go for Salatul Jummah or for congregational prayers. And now Ramadan just around the corner, we won't be able to attend for Taraweeh prayers. Many people won't be able to attend the masjid for breaking their fast. So there is no question this will be a very different Ramadan for all of us. And hence we need to really work to plan and to get the most benefit out of it this month, inshallah. Alongside that, there will be a couple of other presentations from the health side and also from the economic side, because all of these things are affecting our communities. So I'll hand back to Zainab, inshallah, and hope that everybody benefits from today's presentations.
Thank you so much, Harun. So today we'll be hearing from Dr. Salman Waqar from the British Islamic Medical Association, who will be advising us on how best to fast in accordance with medical advice. We'll be hearing from Ahmed Afzal from Ramadan Tent Project about how to bring Ramadan into your own homes. We'll be hearing from Imam Rehan from Cheadle Masjid about engaging spiritually at home this Ramadan. And then we'll be hearing from Brother Shakil Raja about the economic support that's available to individuals and businesses and employers by the government. Everyone, all of our panelists will be taking questions. Please submit questions via the chat facility here on Zoom, and then I'll be able to ask each of our panelists the questions directly. This session is being recorded and will be shared on social media and by our mailing list and our various WhatsApp update lists shortly. All of the updated information on the COVID-19 pandemic is available on the MCB website. That's www.mcb.org.uk/coronavirus. So if I could hand over to Dr. Salman Waqar from the British Islamic Medical Association to start.
Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Salman Waqar. I'm the General Secretary of the British Islamic Medical Association, and this is just a short update to really try and set the scene for what has happened in the last week and what the next week may be bringing. And I just wanted to start with a graph that's been taken of the number of cases and the number of deaths that have been reported in the UK in comparison with other countries. And it seems to be that our cases are continuing to rise, our deaths are also continuing to rise. And it's not quite clear as to whether or not we have reached the peak yet, unfortunately. The initial estimation was that this weekend would see the worst and things would get better, but that has, to the best of our knowledge, been revised to next week. So that means that we need to keep the pressure on. What's more interesting is that the disease burden of COVID has actually switched from Asia to Europe and North Africa. As you can see, that the US now accounts for a third of the deaths across the world, and the UK is now reporting more deaths than Italy or Spain put together. And we know how difficult it was for them when we were listening to the news stories about what was going on there just a few weeks ago. All of this really reinforces the message that even though the weather may be glorious today for many of us, that it is entirely inappropriate for people to be going out, meeting friends, meeting other people, congregating, despite having good weather, because if that happens, the deaths and the cases will continue to rise. And this is particularly important as we enter into the holy month of Ramadan, when there may be a temptation to perhaps maybe just go out and visit relatives, perhaps maybe just go and sit with someone for a few minutes. But really, that is all that's needed to potentiate the spread of the virus. So it's incredibly important that people take the advice to stay at home seriously. It doesn't matter if it's for 5 minutes or 50 minutes. Contact with people will increase the spread of the virus and unfortunately will cause more people to pass away from it. So until we get further advice from the government and from experts about when we can ease social distancing and ease our isolation, we must continue to stay the course. The other important thing that's been noted actually is, as a result of this, the situation with COVID, that unfortunately people who have other conditions which are still happening, people are still getting infections of their appendix, people are still having heart attacks, people are still having strokes, etc. People are scared, people are unsure, people are delaying the presentation to speak to a healthcare professional, to go to A&E, to speak to GP or to 111. And unfortunately, there have been a small number of cases where sadly children have become very unwell and have even died because their caregivers delayed in seeking presentation. So I just wanted to really reinforce the importance of seeking medical attention. And if you are unable to get through to someone on the phone, to take your loved ones, particularly your children, to A&E to seek timely medical attention. It's worth noting that children very rarely become unwell with coronavirus. So if a child is very unwell, it's very unlikely that it's something other than coronavirus. And hospital A&Es are set up to receive people, and they will see them in a timely manner, because across the country, A&E attendances have come down. So A&Es will see you quickly. But of course, if you don't have a serious illness, do whatever you can to stay at home and self-care, speak to 111 or speak to your GP. Now, the main issue that's on a lot of people's mind is around Ramadan and COVID-19, the coronavirus. And so what we've done over the last week is a few things. Firstly, we've issued this guidance in association with the Muslim Network at the Department of Health and Social Care, which is mainly for managers and employers. So if any of you do know people who are working in the NHS, please do signpost them to this advice, which is essentially outlining the importance of Ramadan to Muslim staff members and how managers can help support them, particularly with praying at work and offering flexibility in their shifts, in particularly so in light of the COVID-19 pressures. The most the biggest piece of work that we've been undertaking are these rapid evidence reviews on Ramadan and safety, which essentially is an attempt to synthesize the existing evidence on what we know about fasting in Ramadan with certain long-term conditions, and trying to present that in a way that scholars, patients, and the public can understand. There's been a great deal of work done in this area on diabetes, and this table on the screen here just outlines the type of information that we know about diabetes, about which types of patients should be advised to not fast, which types of patients could consider fasting. And of course, if anyone does have any questions, it's very difficult to answer specifically without knowing the medical record and the medical history. But in essence, fasting remains an individualized decision. It's individualized to the person's ability to fast and to tolerate the fast, particularly in these summer months and in light of their occupation and other commitments. And it's also based on the medical advice that we would give you based on what conditions that you may have. At the moment, there doesn't seem to be any evidence that suggests that fasting would increase your risk of developing, catching, or deteriorating with COVID-19. Of course, if you are unwell, there is dispensation given to anyone to break their fast. But from what we know, you're not more likely to become ill in this Ramadan with COVID-19 if you were able to tolerate the fast safely in previous years. We understand there's a lot of unknown, there's a lot of anxiety, and particularly because of disruption to services, some patients may find that if they were previously able to fast in Ramadan only after having blood tests done or having spoken to their GPs or their specialists or specialist nurses, they may find that this is difficult to do in light of the burden that is placed on the service. And so the advice there really would be to consider not fasting until this is able to be done safely. What we've done, and this is available on our website, britishima.org/COVID, is release 2 papers. These are the first 2 papers in a series that we will be releasing around the evidence on these conditions, as I mentioned. The first one here is around occupational health. So this is for key workers who may be working long shifts, maybe wearing PPE, maybe performing highly complex tasks. And this summarizes the evidence around that. The other paper there is around immunity and infection risk, which looks at some of the evidence around what Ramadan fasting does to the body in terms of its immune system and the likelihood of you developing infections. And you're, of course, free to read them and to share them, particularly with employers if you feel that you're finding it difficult to have flexible arrangements. One of the other things we've also been aware of is the fact that visitation policies in hospital trusts are becoming tighter. And this is from 2 angles. One, patients are finding it difficult to visit their loved ones who are in hospital and very sick. And on the other hand, staff members are reporting that some patients are becoming more angry and becoming more combative and unfortunately obstructing the ability of very busy and very overstretched clinical, administrative, and even chaplain services from carrying out their jobs on the ward. And what this document's basically trying to do is to plead to trusts and to patients that this is a very, very challenging situation, and there may be cases where unfortunately individuals may not be allowed to visit their loved ones, particularly in critical care, simply due to a lack of staff, due to a lack of appropriate PPE, to prevent infection being passed back onto the family members as they go home, or infection being introduced onto the ward where there are some seriously sick people there. What we're trying to do is to explore the role of chaplains, and I know they're doing a fantastic job, but we are encouraging trusts to really work with them, and particularly patients need to realize that chaplain services are available in trusts to be with loved ones, particularly at the end of life if people aren't able to visit. And it's important that the community as a whole is aware that forward planning is vital in overcoming these challenges. If any of you do have a relative who is frail, who is elderly, it's important that you discuss the wishes with them beforehand. particularly plans about resuscitation, but also plans about what might happen if no one is able to visit. It's also important that the family nominate one individual, ideally who is able to speak good English, to communicate with the hospital staff, because this can also cause problems not only in terms of training and PPE, but also in terms of mixed messages. We're also in the process of releasing some videos which help explain the issues around the end of life, aimed for the Muslim community, trying to dispel some myths and explain that the way palliative care works. And these, inshallah, will be coming out very shortly. So that's our presentation. We can be contacted at covid@britishima.org. As I mentioned, the resources are hosted at britishima.org/COVID, and we're also available on our social media, and those are our handles there. That's the presentation from us. Zainab, I'll hand back over to you if there are any questions.
Thank you so much, Salman. We have a number of questions in for you, which I'll get started with. The first question was, and I believe you briefly touched on this at the start of your presentation, so maybe it's just worth reiterating. The question was, are we exempt from fasting on the grounds that a dry throat increases your risk to respiratory infection from COVID-19, even for otherwise healthy people?
So in otherwise healthy people who would normally fast in Ramadan without any problems, there is no evidence to suggest that Ramadan increases your infection risk. It's important to caveat all of this with that there are no data for fasting and COVID, because we wouldn't know, and there's lots of unknowns about COVID. But from what we know about other viruses, including other coronaviruses, there doesn't seem to be an increased risk. It's also important to mention and for people to consider, as a result of social distancing, isolation, and for those seriously vulnerable, shielding, people will be staying indoors more, so they're less likely to pick up infections. They're going to be less likely to, they're going to be resting more, and they're also not going to be spending as much energy. So there may potentially even be some protective benefits as well, on top of what the evidence may suggest in some areas, and it's inconclusive, that fasting may confer some immunity benefits. But I encourage people to look at the document that we've produced. As I said, there is no conclusive evidence one way or the other, but if you're fit and healthy, there is no evidence to suggest that fasting in Ramadan during COVID will put you at increased risk of anything.
Thank you. And then we had another question that asks whether fasting is dangerous if you have any level of symptoms of COVID.
Any what symptoms, sorry, of COVID?
Any of the symptoms of COVID, or any degree of the symptoms of COVID, whether fasting is therefore dangerous.
So again, and the advice is the same as it has been before COVID. If you're unwell, you have dispensation to break your fast. Because of the uncertainty around COVID, that decision for individuals may want to be taken at a slightly, they may want to take that decision at a slightly lower symptom threshold, whereas before, if they may have waited until they had a fever, in this case, if people start to become short of breath first, they may want to consider breaking their fast. Certainly, if someone is very unwell, we all know common sense would dictate that you don't fast. But as I said, the evidence suggests that if you are a well person, there's nothing that will make you more unwell if you decide to fast.
Thank you. And then we've had a few people ask specific questions about their conditions and whether or not that might mean they are able to fast. I know you said that you're not able to comment on individual cases without knowing their history. So would you advise individuals to try and see if they can speak to their GP ahead of Ramadan, or what do you think is best?
Absolutely, and thank you for reminding me. It's really important, especially the fact that we have a few days ahead of us before Ramadan begins, is that people should, if they can, contact their GPs, bearing in mind that GPs are incredibly busy, so that may not be that straightforward to get in touch with them. But if they have got medical conditions and they normally would speak to their GP, please do that. Or if you are uncertain, speak to your GP or pharmacist to get more information. If possible, or where possible rather, try and take voluntary fasts leading up to Ramadan, so you'll understand how your body is coping, particularly with this warm weather that we're having, and particularly if you are a key worker who may be working slightly more strenuously than you would before. So those are important things for you to take. But unfortunately, yes, I'm unable to comment on specific conditions, although I appreciate that is where most of the anxiety lies. Hopefully, when we release our rapid review, there'll be more evidence for individuals and their clinicians to make more informed decisions about moving forward. But it has to be a conversation with your GP.
Thank you. And then we have a couple more questions. How beneficial are homemade masks and visors that people are making and gifting to their local pharmacies?
So the issue of masks is being debated, and the American sources, the CDC, have released guidance suggesting that the American public should consider making masks or even purchasing masks or even making masks. PHE haven't made such suggestions yet, but if people want to make them, there are resources available online as to how they can be made. Effectively, what masks do is prevent you from transmitting your germs to other people, and to a lesser degree stop germs getting into you. So the effectiveness is difficult to quantify. The most important thing is, if you are wearing a mask, is that you wear it to cover your nose. It must also cover your nose and your chin, but you also must refrain as much as possible from touching your face, because that will then undermine the purpose of having a mask. Unfortunately, I've seen a lot of people in public wearing masks but constantly touching their nose, constantly scratching their forehead, and that just unfortunately introduces the more likelihood of you transmitting something. But those resources are available online, and unfortunately the conclusive nature of what masks may do is uncertain. What we do know, and is this a confounding factor or is this something else, is that the Eastern societies, so Japan, South Korea, China, Hong Kong, Taiwan, there's a strong culture there in the public of wearing face masks, and their curves are much flatter than what we've seen in Europe and in the West. So could masks be a contributing factor to that? It's very difficult to know. You know, you wouldn't want to imply causation from that, but these are just some things to consider.
Thank you. And then, do you have any specific advice on diet during Ramadan that may help to increase the immune system of a fasting person?
So again, from a Western empirical evidence point of view, the advice is to have a healthy, balanced diet, and details of that are available on the NHS Choices website. There are some people are talking about vitamin C, for instance, and there is some weak evidence that may suggest that vitamin C at high doses in acute illness may be beneficial. Excuse me. Vitamin D deficiency is also being thought about as being a potential mediator of immunity, but again, that is unclear. And of course, people are talking about prophetic remedies such as black seed and honey, and certainly taking those in small amounts wouldn't be harmful, but their benefit is yet to be seen in, as I said, in a sort of Western empirical evidence perspective. But what I've advised is that people generally know what a healthy diet is, generally know when they're not being healthy. So if you want to get more resources, the NHS Choices website has some fantastic resources about how to maintain a healthy and balanced diet. And particularly with Ramadan, the most important thing is that people maintain adequate hydration. And starting that process from now, so cutting out caffeine, cutting out fizzy drinks, making sure that you get your body used to having a lot more water, are things that certainly people can do to start preparing for Ramadan in earnest.
Thank you. Someone has asked, how much of a risk is it if an elder person in their mid-80s is having COVID symptoms to take them to hospital?
So again, it's what does one mean by COVID symptoms? And this is where it has to be an individualized decision based on the person's medical history and the length of symptoms and the severity of symptoms. And I would advise in that case for that person to contact 111 or their GP and get a telephone or face-to-face assessment by a GP done. In that consultation, it can then be made clear as to how severe those symptoms are. People who are able to be managed at home, we will do absolutely everything to ensure that they can be managed at home. People who have to go to hospital, we will have that discussion with them about the appropriateness of going into hospital, given what we know about COVID and the fact that the elderly are unfortunately more likely to pass away from it if they are affected, and they are less likely to be offered ITU because of futility. So that conversation needs to be had. So rather than waiting for someone to become unwell and have that conversation, it's really important that families, as difficult as it is, to have that conversation in earnest while people are compos mentis. They have their faculties, they have capacity, and they're able to discuss their wishes. This may also include the option, and may Allah protect us all, if someone wanted to pass away in their own home, surrounded by their own loved ones. So these are all the sorts of things that people unfortunately need to be discussing, particularly with elderly relatives. But to come back to the question, to quantify that risk is very difficult to say. It depends on the performance status of the individual, as I said, on the medical conditions and what type of symptoms they're having, and what is the ceiling of care that is available in the community, and that has to be done on an individualized basis based on an assessment made by a qualified clinician.
Thank you. There have been a number of people who have been self-isolating for more than 21 days now and are not showing any symptoms. Is it safe for them to go out and volunteer with the number of community initiatives we've seen pop up now that they know that they don't have coronavirus?
So if you have been isolating and you're symptom-free, it's likely that you don't have coronavirus. But that doesn't mean you're not likely to pick it up and then pass it on to someone else, because the minute you walk out the door and shake someone's hand who has it, you've got it. And then for the next potentially 2 weeks, you could be spreading it around to someone else. So if people wish to volunteer, wish to work and are symptom-free and are healthy, absolutely, it's important that people do that, especially where there is a need for it. But it's important that adequate protection and adequate cautions continue to be taken. And people don't assume that just because I've been at home for 20 days or 21 days, I'm somehow not going to get coronavirus now. You could get coronavirus the minute you walk out the door, the minute you decide to pop over to visit your relatives. Unfortunately, we have actually been seeing a few people, a few cases of people doing that, thinking that, all right, we've all been camped together for 21 days, let us all meet and mix. And unfortunately, that's not how one stops the spread of a condition like this. So social distancing, self-isolation, very important. If you are going to enter into the workplace, whether that's through volunteering or through picking up a job as a key worker, it's very important that you continue to take precautions and you continue to take advice from your employers as to how to minimize risks and not bring them back home and spread the disease further.
Thank you. And then one final question. Has there been a genetic breakdown of the virus, and are Black and minority ethnic people more susceptible? And if so, do you think this is due to genetics or maybe social conditions?
So short answer is we don't know. There's lots of reasons that could explain what we're seeing. So the data that are coming out, these are audit data from from ITUs, showing that BME communities are represented more than in non-COVID situations, and why is that happening? lots of reasons. As you mentioned, genetics could be a factor. We don't know. Could it be because London and the Midlands are one of the first areas to be hit in the UK, which have a greater proportion of BME people anyway? Possibly. Could it be because we know that BME communities, of which Muslims make up a third, are unfortunately more socioeconomically disadvantaged and therefore suffer more health inequalities as a result of those socioeconomic determinants? Possibly. There's lots of reasons as to why that is, and I think we have to be very cautious about making it out that we are somehow responsible for this, which is unfortunately what some of the narrative has been around. A lot more data needs to be done. Very few BME communities are part of clinical trials even before COVID. So it's really important that those people that are offered trials, if they are in hospitals, do consider taking them up because of these variations that we're seeing. And so, yeah, there's a big question mark over this as to why this is happening. We are seeing a similar sort of thing happen in New York and in Chicago amongst the BME communities there. So it doesn't seem to just be something that is unique to the UK or unique to Muslim communities, which may seem to give more credence to the fact that this is just an exacerbation of socioeconomic inequality. So people who can't afford to self-isolate and they have to work and therefore expose themselves to risk, or the fact that BME communities make up more of the patient contact, patient-facing or public user-facing industry, and therefore placed more at risk, or the fact that BME communities may be marginalized in the workplace and not able to speak out because they don't have adequate protections. These things may seem to be more likely, but it's very difficult for anyone to make any causation based on the data that we're seeing.
Thank you. Thank you, Dr. Salman. There was a question about mental health support for Muslims during this time, and I just wanted to signpost to a number of organisations, Muslim organisations, who are working to provide mental health support during this pandemic. All of this information is available on the MCB website, where we can signpost you to these organisations, which is mcb.org.uk/coronavirus. But I will just name a few of these organisations who I would recommend getting in touch with, who might be able to help. There's the Muslim Youth Helpline, there is Inspirited Minds, there is BIMA, there is Mindworks UK, and there is Sukoon. So there are a number of organisations working within Muslim communities to provide mental health support. We'll have Brother Ahmed Afzal from Ramadan Tent Project talk about how to hold a remote Ramadan in your home, and he'll start off by showing a short video. Thank you. We'll now have Ahmed Afzal to speak about My Open Iftar from Ramadan Tent Project.
Assalamu alaikum all. I pray that you and your family are safe and well, inshallah. I want to take this opportunity to thank the MCB for giving us the opportunity to chat about My Open Iftar. And for those of you who don't know me, my name is Ahmad, and I'm the head of operations for the Ramadan Tent Project, a not-for-profit organisation. The mission of the Ramadan Tent Project is to bring communities together to better understand each other, and one way we do this is by organising the UK's largest community event in Ramadan, our flagship event, the Open Iftar. And you would have seen from the video just played that during a time of physical distancing, we are now bringing you My Open Iftar. Before I chat further about My Open Iftar, which is our contingency plan for Ramadan this year, I'd like to give you all a brief history about our traditional community Open Iftar events. Open Iftar commenced in 2013 on a university campus, and over the years it has organically grown, and last year we held the first ever Iftar in Trafalgar Square, Wembley Stadium and Westminster Abbey, along with many other iconic locations in major cities across the UK. To date, the Ramadan Tent Project has delivered over 100,000 meals and to people of all faiths and none. Due to the current crisis, which we as individuals and communities are facing, it has meant that physical distancing measures have had to be implemented. And as a result, we've had to cancel all 50 of our Open Iftar events this Ramadan. Whilst our Open Iftar events may be cancelled, the Ramadan spirit is not. It's times like this that we believe it is more important than ever before to be a service to our community. As an organisation, we pride ourselves on being dynamic and innovative, and with the launch of My Open Iftar, we have created an opportunity for millions of people to celebrate, share and sustain the Ramadan spirit, while still following the guidelines of physical distancing. Each person who signs up for a My Open Iftar pack will receive a pack that provides people with the tools to host an Open Iftar experience in their own homes, including recipe cards, trivia games, Ramadan fact sheets and advice, and in particular advice on physical, mental health and well-being, along with decorations and much more. These packs are free to sign up to, and you can do so by going to our website at openiftar.co.uk/my. In addition to this, we will also be hosting a virtual iftar every day of Ramadan for our communities, and we will be broadcasting the adhan, hosting an array of inspirational guest speakers, and allowing households to share their iftar experiences with one another. The programme for each evening will consist of a member of the Ramadan Tent Project team hosting the guest speaker and encouraging all joining via our online and social media platforms to converse and create dialogue with one another. Once the call for prayer has been made, each of the guests will be encouraged to have iftar with friends and family while sticking to the physical distancing guidance, and they will also be encouraged to share images and videos of their meals using the hashtag MyOpenIftar on the various social media channels. I just wanted to end by sharing some thoughts with you on the current pandemic. For some, this current pandemic is a test. For others, the pandemic is a punishment. I've been fortunate enough to host a series of webinars in preparation for Ramadan, and last week I held a webinar with a sheikh who is local to me, and he reminded me that this pandemic has taught not only him but others around us about how fragile human beings are. This dunya consists of the most complex economic systems. There are individuals with the best education and wealth beyond imagination. However, this is not enough to combat this pandemic. The Sheikh also reminded me of the ayat from the Quran, "Verily with hardship comes ease." As Muslims, it is our duty to have faith in the Almighty. He is the sustainer of this world and He is the best of all planners. We are currently in a time where our iman is being tested in one way or another. For some, it will be a spiritual test, a test of faith. For others, it will be a test of health. And for others, this test may come through other avenues, such as financial difficulties. I ask you all that you use this time and opportunity to catch up on the very things you never used to have time for, whether it be praying your salah on time, reading Quran, or using the time to self-reflect, to improve and grow, so that we are not only improving ourselves for the month of Ramadan, but we improve and continue to maintain ourselves for the remainder of the year. We also need to use this opportunity to improve our communities, to strengthen our ties with our neighbours, and be there for one another. There has never been a need like there has today, where communities around the globe require that spiritual and human connection. The Prophet Muhammad, peace be upon him, has stated that the best of people are those that bring the most benefit to the rest of mankind. As Muslims and as human beings, it is our duty to protect the most vulnerable in our communities. We are obliged to follow the current physical distancing guidelines and stay at home, protect our NHS and save lives. I appreciate that this Ramadan we may not physically be around each other, but with My Open Iftar, we can be there for each other and our communities spiritually and virtually. Finally, I would like to take this opportunity to thank the whole Ramadan Tent Project team for working tirelessly to bring you my open iftar, and I want to thank you, the listener, for your time this morning. I'll now take any questions, Zainab.
Thank you so much, Ahmed. Could you please just reiterate how people can sign up and how they can get involved and all of the website links, please?
So if you have a look at the website is openiftar.co.uk. It's currently on the screen right now. So it's openiftar.co.uk/my. And what you can do is you can sign up on there. So it'll ask you for your details, your address, and then once you've registered, we'll have a team of people working who will then send out a pack to the individual. And in the packs, the individual can then sort of have all the necessary tools they require to host their own iftars in their homes. We'll also then have information going out on our social media channels where people can join via social media streaming or via Zoom, and they can join the daily speeches and the Q&A sessions.
Thank you so much. Have you considered partnering with organisations like Deliveroo or Uber Eats to donate iftar meals for key workers?
That is something, I can't reveal details at the moment about that, but that is something the team are working on, and all I can say with that is just watch this space for the time being.
That's great. Thank you so much, Ahmed. So I would, before we hand over to our next speaker, I would just like to reiterate that there is a lot of mental health support available in Muslim communities. I sent a link in the chat facility to a tweet of ours which highlights all of the different organisations that are doing this great work and how you can contact them. I'll resend that again so people can see it. And now we will be joined by Imam Rehan Saleem of Cheadle Masjid to speak about how to engage spiritually this month of Ramadan in our homes.
Assalamu alaikum, everyone. I hope you can hear me well, inshallah. Bismillah ar-Rahman ar-Rahim, wa salatu wa salamu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallim tasliman kathira. I hope you're all well, inshallah, these days. We're about 1.5 weeks away from Ramadan. And I've been asked to talk very briefly about how do we spiritually prepare. And it was a good question, actually. I thought, because I was thinking about myself and my family being stuck at home, so it was a good idea to kind of prepare and think about what we need to say. But essentially, brothers and sisters, I want to set the scene before I go into some practical tips. When we think about Ramadan, we understand, we hear the ayah and the verse every year. يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. That, O you who believe, fasting has been prescribed for you as it has been prescribed for those before you, in order for you to attain taqwa. Now, this last part is something I just want to focus on. Allah says, لَعَلَّكُمْ تَتَّقُونَ, which basically means for you to have taqwa. And the scholars say this is an illah, this is a reason, and this is the objective of fasting. And the reason I want to start off with this is because when you consider that the objective of fasting and the objective of Ramadan as a whole is to attain taqwa, then you understand that you're not restricted by time or location. So regardless if you're inside, you're outside, we always, I think we tend to think of Ramadan as a time when we're, going to Taraweeh at the mosque, or we're going to Asda's and Tesco's, when we're doing our pre-Ramadan shopping. And so we think that Ramadan is kind of a very much a communal thing, which it is. But the reality, when you look at the overall objective, the mega objective of Ramadan is that it's to have taqwa. And so what is taqwa? Taqwa, brothers and sisters, very briefly, is that you put between yourself and between the punishment of Allah a barrier. It's from waqar, to mean protect in the Arabic language. And the scholars, the best way that the scholars kind of practically implemented that, they said that it was to do your obligatory deeds in such a way that you have hope with Allah, and that you stay away from the forbidden, the evil deeds, in fear of Allah subhanahu wa ta'ala. And I think this is very important, that in essence, taqwa is that you maintain a state of piety whereby you do everything Allah says and you stay away from the forbidden. And so you're not held by the dunya, no, you're not held by the temporal world in terms of the desires of money, of wealth, of other people, etc. And this is something which you are able to connect with Allah spiritually. And that's what the essence of taqwa is. And so, brothers and sisters, I wanted just to touch upon that when we think of Ramadan, when we enter into Ramadan, understanding for myself first and foremost, that taqwa in itself is the objective. And how we get to that is what we, inshallah, will talk about. So, in terms of what can we do practically, and I only have a few minutes, so I didn't want to kind of overdo it. I know, mashallah, there's lots of classes online, left, right, and center, so I didn't want to bore people, but I do want to mention two overarching practical things we can focus on. Number one would be the Quran, and we know that the Quran, brothers and sisters, is always talked about, but I want to specifically mention something about the Quran. The Quran, brothers and sisters, we know that the Ramadan essentially is equated with the Quran. Shahr Ramadan alladhi unzila fihi al-Quran. That it is the month of Ramadan, which is the Quran was revealed. But I want to share a quote with you, which I felt was very, very apt. Ibn al-Qayyim al-Jawzi, a great scholar of the past, he said the superiority of the Quran compared to the rest of speech is the same as the superiority of Allah subhanahu wa ta'ala to the rest of creation. And when you think about this comment, you actually realize the level of the Quran. The same way you cannot compare Allah, who is the most, the most powerful, the omnipresent, the one who has capability to do anything he wishes, the first and the last. He has no limits. The same way you cannot compare him to ourselves, who are limited by our intellect, limited by our ability to do things. We cannot create anything except by his will, etc., etc. And so the Quran, the same concept, that the Quran as an entity cannot be compared to anything else in terms of any other speech, any other books, any other kalam, or any other words. And when we understand that, we realize that because the Quran is directly from Allah, that the one who engages with the Quran, he is engaging with Allah subhanahu wa ta'ala directly. And that is very important, that because when we come into Ramadan, brothers and sisters, and I say this for myself as well, because of course, even though I'm speaking as a kind of preaching, I have to remind myself first and foremost, because I don't want to sound hypocritical. But the reality is we don't really give the Quran its level that it deserves. But what I want to say is a few things that we can do practically, because there's different levels in terms of who can do what. The first and foremost I'd say is that really try to, number one, read the full Quran in Ramadan. Even if you're finding it difficult, the more that you strive towards it, the better you'll feel. There is a spiritual element there which one can gain. So try to read through it. Another one would be to read it in English. Of course, reading in English is also good for the understanding. But take a tafsir, any tafsir, Ibn Kathir, you can order one now, get one sent to your house by, Kitab, and there's many other websites you can order a very nice, simple English tafsir. Yourself and the family read through a few pages. You don't need to do the full Quran, just do a few pages, a few surahs that you can choose, and you'll find it very beneficial in terms of your relationship. The other thing I'd say for those who are learning a bit of Arabic, another tip is there's a document online called 80% Words of the Quran. Definitely advise for people to download that. It's free. You will learn, many of the simple words that you'll find, khalaqa, you will learn the stawa, all of these simple words. Now, even if you don't know the Arabic language, once you start to try and memorize or understand these individual Arabic words, you'll understand the context when you hear an ayah of Quran. And that will help you, inshallah, to get closer to it, especially for those who don't know Arabic. It helps and strengthens that connection. And finally, in terms of Quran, I would say that it's a very good opportunity, being stuck at home, to establish Taraweeh in your houses. I would say that, set a time. I was thinking about myself, what time, 9:30, 10 o'clock. You set half an hour whereby you do your Isha prayer with the family. And then you do, maybe you can do 8 rak'ah prayer. You can do, if you want to do 20, if you want to do 4, if you want to do 2, it doesn't matter. You do something whereby you can read as the imam or whoever the family member can read, and it's permissible according to many scholars that you read from the Quran itself, from the Mus'haf. If you haven't remembered enough of the Quran, then many scholars did allow that you can read it from the Quran. Just place the Quran in front of you on a stand and read through. And Imam an-Nawawi and other scholars said there's no harm as well in the nafil prayers, in the supererogatory prayers, for you to actually change turn the pages with slight movement. There is difference of opinion, but I would say take the concession in this time in order to strengthen that. So that's from the Quran, brothers and sisters. That please, from myself and for yourselves, the essence of Ramadan is the Quran. The other thing I would say, of course, in addition to Quran, just generally seeking knowledge, online lectures, reading books is a very good time to kind of invest in kind of knowledge management, making sure that your knowledge is up to date. Reading anything, it's good to keep the mind active, and I'm sure we will be doing that for the last few weeks anyway. The final thing I want to end on, which is just as much as important in terms of the isolation, and we have to bear in mind isolation, but I want to kind of touch upon a thing that the brother mentioned before, is that the actual is being there for others. Now, people will say to me, Rehan, stop here. Don't tell people to be there for others. They're not supposed to go outside. Totally understand. No one's asking you to go outside. No one's asking you to go visit your neighbors or go to see your family. But what I would say is that there is a lot of mileage in terms of being there for people, at least over the phone or via WhatsApp, etc. The reason I say this is if you look at, for example, people suffering from mental health, and it was mentioned before, I know, for example, people who are really struggling at this time. They're stuck at home. They're not able to go out. They're already having anxiety. You know, people who have got anxiety, as you know, they'll be having all these thoughts racing through their head. They need someone to speak to kind of calm them down. Be there for those people. You know, the Prophet ﷺ, he mentioned a hadith which is sound in its chain of narration. He said, for me to be for my brother at the time of his need, for me to walk with him at the time of his need, is more beloved to me than to do i'tikaf in my masjid for a month. This is a very important narration, that being there for others, even if it's you're just consoling them, you're looking after them, you're helping them, this is something, brothers and sisters, that there's so much reward you will not know until you meet Allah subhanahu wa ta'ala. And so there is something to be said about making sure that those people you feel are vulnerable, giving them a quick call, giving them words of encouragement, sharing books with them, just having a general conversation. Inshallah, there's reward. The other thing I would say is also those domestic abuse. I know, and many of you will be aware, that issues between wives and husbands are increasing exponentially at this time. I got a call 4 or 5 days ago, and I only mentioned this so you to know that, you know, we all have to be aware. A woman was domestically abused by her husband. They had a fight. The police were called, actually by the husband, and she was taken away. But the worst thing was that she was actually expecting, and she was being punched and kicked. Now, the reality is that, of course, you can't help as an individual stuck at home. But what I would say is that there is something to be said about where people, yes, they will phone up Solace and they will phone up other organizations, but there is something to be said for wives and for husbands who are having issues, that sometimes they open up to their friends more than anyone. Sometimes they do. And to give them good, solid advice of patience, of gratitude, making sure that you give them advice. They will not come to an imam every single time. We have to be very, very clear that there'll be people within your circle of influence as individuals, whether you're a doctor or a teacher, that you will know who will need that. So I would just say that be there for those people and know that Allah subhanahu wa ta'ala will reward you accordingly. Finally, I end on a final statement. I don't know if I think I've gone too long, but I'll just quickly mention this point. The Prophet ﷺ mentioned in a hadith, as part of a longer hadith, he said, Bashiru wa la tunaffiru. He said, give glad tidings and do not repel people away. At this time, brothers and sisters, we know that, of course, the doctors and nurses, their whole job at the moment is to save lives. And we accept that, and we need to make sure that we toe the line. And it is their responsibility as well as ours to make sure that we tell people to stay at home. But for people who are stuck at home, who are speaking to their friends, people who they're being looked up to by others, this is a time now where we need to instill encouragement and confidence to people. We need to make people feel good. Of course, we tell people not to go out, but at the same time, we need to make sure that we're giving words of encouragement, we're helping people. It helps with mental health generally. But I would say that we need to take it upon ourselves that we create an atmosphere of positivity. Inshallah, we'll get through this very soon. Of course, there'll be issues on the way, but we know that everything is by the qadr and the will of Allah subhanahu wa ta'ala. And so we do our best in patience, but we also encourage others to patience. And we ask Allah subhanahu wa ta'ala that He makes it easy for us, and that inshallah we have that Ramadan which is very spiritually uplifting for all of us. Subhanakallahumma wa bihamdika ashhadu an la ilaha ant astaghfiruka wa atubu ilayk.
Thank you so much, Imam Rehan. That was really, really powerful. We are running short on time, so I'll just run through a few questions briefly. could you please reiterate the link for the 80% of the Quran course, and if there are any online resources or classes that you would recommend, if you could just highlight some of those, please.
Yeah, so very quickly, I think the best way for the 80% is just, I think, Google it in Google. That's standard answer for everyone. 80% words of the Quran. There'll be PDFs there. It'll be one of those, inshallah. In terms of what's available, I think, so I'm affiliated with an organizers too, Cheadle Masjid and Al Ma'arifah Foundation. Al Ma'arifah Foundation, we will be doing some courses and some general. We'll be doing something next Thursday, which will be like a conversation style. You can type in Facebook or Instagram. You can just add us, and then inshallah we'll add more things. But I'm sure many of you will have seen in your contacts on Facebook quite a few things happening. I can't remember many off the top of my head at the moment. Yeah.
Thank you so much. There were two other questions I wanted to ask you. It's great that we can perform Nafil Salah by looking into the Mushaf, but could you explain how that might work in practice?
Sorry, I didn't get that. Sorry, say that again, sorry.
You mentioned that we can perform Nafil Salah by reading the Quran directly.
Yeah.
Could you explain how that might work in
So
practice?
very quickly, what I would say is that if you're doing Taraweeh, which is considered to be a supererogatory prayer, not an obligatory prayer, it is inshallah permissible according to the Shafi and the Hanbali madhabs, whereby you would be allowed to basically, you can have like a stand and the Quran on the stand, and you do your Surah Al-Fatiha, and after Surah Al-Fatiha, which is the opening part of the prayer, you're supposed to recite a surah. Now, many people only know Qul Huwallahu Ahad, or the last 3 surahs, or the last juz of the Quran, which is fine, and you can repeat those. But those who want to extend their prayer, so that they want to make it feel like it's 45 minutes in the masjid, they can read, so it's in front of them, they read directly from the Quran, and they can flick the pages if needed, and they can read as many pages as they wish like that, and then they can go into ruku'. Of course, it's better, you are allowed to hold it in your hand as well, but I caution against that, because when you go into sajda, you take the Quran near the floor, and I definitely say don't do that. So can I try to keep it on a stand? Yeah.
Thank you so much. I think you answered both questions at the same time. So thank you, Imam Rehan. And just to reiterate, he's from Cheadle Masjid, and they said that they will be sharing a number of resources that they'll be publishing on their Facebook and Instagram pages. We'll now be joined by Brother Shakil Raja, a financial advisor, who will be speaking to us about some of the economic support that's available in light of the COVID-19 pandemic.
Assalamu alaikum.
Alaikum salam. Thank you.
My name is Shakil. I'm an accountant in a small firm of accountants in West London. I've got 30 years of experience, and I'm here to talk about COVID-19 and the financial support available from the government. There is a lot of support available, and there's a lot of websites, government sites, which give a lot of information on this. But if there's anything specific that anyone needs to know, they really need to contact their accountant, who will be able to put them in touch. Or
oh, I think we might have lost you there.
Or to you, then ultimately the catch-all is the universal credit system. And if people are suffering or don't have any source of income or unable to pay their way, then they need to make contact with the HMRC through the universal credit scheme and register there to try and get assistance with housing benefit, with other benefits, unemployment and so forth. The important thing is that you need to take advice wherever possible on this, and the important thing here is really to ensure that cash flow is the key to running a business. Cash flow is what's going to keep you going over the next few months, and therefore the advice is that you try and get assistance from the government wherever possible using their schemes. The important thing, first of all, is to try and minimize costs. And that can come from deferring tax payments, which are available. Any VAT that needs to be paid can be deferred until the 30th of June. Any self-assessment tax liabilities that are due at the end of July can be delayed until the 31st of January. So again, that's going to help with cash flow. And then there are other ways that you can help if you are involved in the retail or in the hospitality trade. then there is assistance with business rates being cancelled for this coming tax year, or the possibility of a free grant being given to you by the government, which comes from the local council. The councils will be in touch with yourselves. If not, you need to speak to the council and see if you can make an application. Grants of up to £25,000 are payable, although smaller businesses will get £10,000 if they're on the list of approved businesses. The other thing that you can then do for businesses is, if you're employing employees, is to take advantage of what's called a job retention scheme, which is where if you have staff that you would ordinarily have made redundant, you can furlough them. And this means that they cannot work for you, but they can go home. Well, obviously they're at home anyway, and they sit there and wait until their furlough ends. During this period, the government is prepared to help with up to 80% of their salary and tax and pensions payments based on the February payroll. So whatever is being paid in February, the government will give up to 80%, and this is something that you have to make a claim for. This, again, can be assisted through your accountant, and there's a portal being written by the HMRC which will allow businesses to join and receive these funds. The rule is that if it's not done by the end of March, you would still have to pay them, and you're not meant to wait until the grant arrives. So again, cash flow is key to this. The next way of helping businesses is through people who are self-employed, and that might apply to taxi drivers and other consultants and so forth. If you are self-employed, then you can, based on your 18-19 tax return where you showed self-employed income, you can actually ask for up to 80% of your previous year's earnings to be given to you as a lump sum, as long as your business continues to work. You can, in this case, continue to work as well if you are able to, and you will still receive the grant. And this is applicable to sole traders and partnerships. So if you are a taxi driver and you have a certain amount of income for last year, there are limits up to £50,000, and if you go over that, then literally you get nothing if you go over by £1. So again, speak to your accountant, but this scheme cannot be joined until June. So there's a bit of time now where you can research this before then. The next bit of help is where, again, in universal credit, this is a scheme which replaced all the other types of benefits and brought it into one, where you can join online. I believe that over 1 million people joined it in the last month. And if you are able to join, then they will give you an appointment to talk to someone who will then assess you. And it is an assessment between husband and wife to see what your overall income in the house is. And they will base their payment based on that, and could have an impact on how much savings you have as well. Ultimately, this is the catch-all for everybody. If you have no other source of help and are suffering as a result of your business having to stop for the time being. The next way that businesses can be helped is if they are in real need of loans and so forth, where they can receive loans from the banks at interest-free for up to a year and so forth. To do this, you really need to be in touch with your bank manager or relationship manager, who will be able to tell you what they can offer. All banks are being asked to be fair in this instance and to pay to give loans of up to a guarantee of 80% from the government. Small businesses are not expected to have to give personal guarantees, so it's better to try and go through this scheme, but there are a lot of requirements, and they will need to see perhaps what your projections might be going forward and so forth. There are a lot of banks that are part of this and are accredited to this scheme, and there's a link on this page where you can actually contact banks to see if they can assist in this way. The other thing to remember is that if you are just a husband and wife company where you have very little by way of salary, you may still be able to be furloughed, which means you may still be able to get 80% of your income from your salary element. But those with dividends are not covered by any of these schemes. Again, I would advise that you speak to your accountants to see if they can give you any advice and the best way to do this. They can also help with the furlough scheme in terms of registering you and applying for the 80% grant, and they can also help with the self-employed scheme to allow you to register in June when that becomes available, and possibly will be needed for cash flow projections perhaps, and accounts and so forth, information that will needed to be provided to the banks if loans and so forth are to be made available. I think that's it for now, and stay home, stay safe, help the NHS, and speak to you soon.
Thank you so much, Brother Shakil. And I would just like to reiterate that all of the resources that Brother Shakil has mentioned, as well as the other resources that we've mentioned on this call today, are available on the MCB website, which is mcb.org.uk/coronavirus. And on there are also ways in which you can stay in touch with the MCB and our coronavirus updates. I'd now like to end by calling on Brother Harun Rashid, Secretary General of the MCB.
Thank you to all of our listeners, brothers and sisters, for tuning in today and taking part and also asking your questions. I hope that you found all of the presentations useful, and thanks to all of our presenters today as well. I just wanted to reflect on another verse from Surah Baqarah. We spoke about Ramadan obviously at the beginning, and the Imam from Cheadle Mosque also mentioned. And within the same set of verses about Ramadan, there is a verse 186, which says that, and when my servants ask you, O Muhammad, concerning me, indeed I am near. I respond to the invocation of the supplicant when he calls upon me. So let them respond to me by obedience and believe in me, that they may be rightly guided. I think the key point of overarching discussion of today is not only about Ramadan and the difficulties that we face, but that we should constantly turn to Allah subhanahu wa ta'ala through the recitation of the Quran, through supplication and lots of dua, to always remember him and to always keep calling upon him. To, there's a whole range of duas that we know. There are fixed duas that we can do around protecting ourselves from illness and so on, but also to continuously seek help and his guidance to safeguard us and our communities as much as possible. So I hope that everybody, inshallah, benefited from today's talk, and Zainab will speak more about it. Now, I would urge many of you, please, if you can support MCB's work as well. So we are a voluntary organization representing a broad spectrum, the largest umbrella organization in the UK. And most of our work is done voluntarily. All of our executive and our leadership are all volunteers. But we also need to keep functioning and keep supporting this kind of work so that we can serve the community as best as possible, bringing together. One of our main purposes is to bring unity, and hence you see a range of people, range of speakers representing Muslim communities for the benefit of everyone. So it's about uniting, it's about protecting our community, and it's about serving our community. So please do take a moment. We have a link to our website, mcb.org.uk/friends. On that page, you can sign up if you want, just to receive occasional updates about the work that we're doing. Some of you are on the WhatsApp groups. There's open WhatsApp groups. We're also on Telegram, so that you can get regular updates on COVID-19. And then beyond that, if you're able to support us in any way financially, you can sign up for a single donation. You can give us a standing order. But the more we have, inshallah, the more we can do with that kind of support, inshallah. So please do continue to share the message as well. So when you get the updates, please pass it on to your friends and family so that more people can benefit. And I know there are many other organizations doing webinars, doing talks and so on. Whichever works, the best one. We're not saying that, this is the only place, but we're doing our best, inshallah, to give as much useful information as we can so that we can help all of our communities, inshallah. Back to you, Zainab.
Thank you so much, Haroon. Thank you to all of you for joining on this Sunday morning, and to all of our brilliant panelists. Just to reiterate, all of the resources that we've discussed today, along with a number of resources, are available on our website. That's www.mcb.org.uk/coronavirus. Haroon mentioned we have WhatsApp update groups and a Telegram update group in which you can receive regular updates from the MCB and regular resources. You can sign up to those both on our website on the coronavirus page. And we also have, we're also able to offer support via email. If you'd like to email COVID, COVID, @mcb.org.uk. This session was recorded, and a recording of the session, along with the slides presented, will be available tomorrow, both on our website, and will be sent out on the aforementioned WhatsApp and Telegram groups. Thank you again for all of you for tuning in this morning, and to all of our presenters. Assalamu alaikum wa rahmatullahi wa barakatuh.